Hello, lovely. How are you? Good. I'm very well, thank you. So, I'm Dr. Nicola, one of the practice doctors here, and I believe that you are a new patient here. Yeah? Well, thank you for choosing us. We really appreciate it. So, when you signed up, you filled in a few questionnaires and different things like that. Okay. Then we got all your medical records sent over to us. Okay, so we have everything now on file from your previous doctors. Okay, so you don't have to worry about that. It's all there ready on the system. Okay, good. And we have all the forms that you filled out too. So we have all that on the system as well. So we've got to worry about that. Okay, yeah. So what we do here is when we have a new patient come and they sign up, go through all the forms, then we get the medical records, then we ask you to come and sit down with your own doctor. Okay. Yes, that's right. So you will see my name above there because I am the main doctor here, if you like. All right, so my list can get very busy and very, very full, very quick. Yeah, that's right. But we take on enough staff and we've got enough patients, so and everyone's not here all at the same time, so we can accommodate that. That's not a problem. I do get a lot of recommendations and people requesting me because my name's above the door, if you like. But I do want to assure you, all the other team here are incredible. I must say that. I mean, we've got a lovely bunch of female and male doctors, nurses, phlebotomists, pharmacists, child section with, the health visitors, midwives, everything. Did they give you a book? Oh, brilliant, they did. Oh, okay, right, you've not had a chance to look through. That's not a problem. We'll go through the book because it shows you what we offer here. So, you've got things where you've got podiatry here, physio here, mental health section here. Then you have obviously the normal doctors section, and then you've got your midwives, health visitors, antenatal classes, and all sorts of different things going on. Yeah, that's why we've called it a health centre, really, because it's, we've all got bits going on here and there. That's right. And that's mine, and then there's a doctor's surgery in here, which is where you are now, and then there is another doctor's surgery, which is the other side. Okay, that isn't a part of my surgery here, but they are a part of my health centre. Does that make sense? Yeah, you will get used to it. So the other place has their doctors. They have doctors and nurses as you would normally, okay? And obviously they can use the services throughout. Then I have my team of nurses, doctors, and, other things here, and we can use all the services within. Does that make sense? Perfect. But the good thing about this surgery is you can see me, but if you'd rather talk to somebody else about something else, or I'm not available, then you can see them, and vice versa. Okay, you don't always just have to see me. That would make it impossible for me to get through people. I always try to aim to meet my patients, okay? But I do my very best, but if I'm off or away or something like that, and slots free, but I assure you, I have a fantastic team here. I really do, and I really love my staff. I think they are brilliant. We've got some excellent doctors and nurses. They are all highly trained, qualified and experienced, all right. But you'll more than likely end up keep seeing me, because people just tend to book me and then they just wait an extra few weeks to come and see me. But either way, you don't have to worry, okay? Yeah, don't have to worry about that. And for our first appointment, we have to do a little bit of a health check with you. All right. So I have all your files and everything on here, but I want to take my own, tests and things, so I can have it all recorded myself. So I'm just going to ask a few questions, not too many questions, because that could get a little bit, tedious. But if you do want to tell me anything along the way, then I can pop it down. Or if I do want to ask a question about something that has flagged up to me, then I'll ask you that, all right? But I just want to be, knowing a bit about you, your lifestyle, and about your conditions and your medication, and are things, okay and moving all right with everything, and do you need any help with anything? And then I just need to do usual kind of, blood pressure, blood test, urine sample, all those kind of things, if that's all right with you. Yeah, and I've got all that up to date then, and then we'll see how we move forward. I think that will be a good thing. But what I'm going to start to do, first of all, I'm just going to load this page up for you. Just a moment. Okay. Right, can I get you to just confirm your date of birth? Okay. And the first line of your address and postcode. Brilliant. And finally, a contact number. Excellent. That's brilliant, thank you. Okay. So. Okay, I see you are on a couple of medication. I would just like to give you, in your own words, just to tell me, what are you on them for? Right, yeah, okay, that's fine. Yeah. Yes, okay, that makes sense, yes, okay. Right. And when did you last have a medication review? Okay, so your other medication you would say you're okay on. Okay, and what about the mental health medication? When was the last review? Right, okay, so I could possibly get you in at another date, I think, maybe, and just go through your medication. Do you think that would be okay? I mean, do you feel like you need changing, lowering, upping, or... I suppose, yeah, and with the weather changing at the moment and the year that we've had and things like that, I can understand. Okay, let's just jot that note down. So, medication review. Because then I can just see you then, and I could do a medication review, and if you wanted a mental health review, yeah? Okay. I mean, might as well. I mean, we can have a good chat. I can get to know about your mental health and things that's going on, and talk a bit more about it, and then I can see if you need any help with anything, and we can go from there. Oh, you're very welcome. You don't need to thank me at all, honestly. I'm here to help you and look after you. All right. Okay. But don't worry. I will definitely book in a medication review and a mental health review with you. Okay. Okay. make that a double swat. Okay, that's fine. So everything that I have on the system for your illnesses, has there been anything diagnosed since, before the move and things like that? Okay, anything gone that was there? Okay, no, so it's all up to date and fine. Brilliant. Not a problem at all. Great. That's wonderful. Right then, what I'm going to do, I'm not just going to start with asking all questions. I'm just going to do a little bit and pop some questions in here and there, if that's all right with you. All right, lovely. Okay, so what I'm going to get you to do first is give you a bottle, and if you could go and do a urine sample, please. Do you have yearly bloods before? Right. Okay. So you should be having regular yearly bloods, checking things out, especially with those medications that you are on. Okay. So here is your sample pot. If you can just fill it to about there. Don't worry if it's a little bit less, a little bit more, please don't panic. Just so I've got enough to pop my strip in there. All right, my love. So there we go. Okay. Yes, you just go down the corridor, it's on the right. Okay, see you in a moment. Oh yes, you can come in. Oh, thank you, that's great. Please take a seat. Are you feeling okay? Good. Okay. Okay, here we go. Seems a nice healthy colour. Just say that's pretty normal for you. Okay. leave that a moment. Do you ever have any problems with your waterworks at all? Okay, that's really good. Yeah, these look really, really good. Fantastic. All clear, no problems at all. Let's put those in the bin. Okay. Right. While I pop these gloves on, if you wouldn't mind just popping over there on those scales and just standing on there nicely for me. Do you know what you weigh off your head? Do you remember? Or... Okay. Do you know when you were last weighed at the surgery? Okay. Don't worry. You're going to pop yourself on there for me. Okay, right, come over to you. Okay, that's you, just stand there nicely. Okay, that's fine. Perfect, okay. Stand down for me. And if you can just pop your feet right there against the board. I'm just going to lift that to the level. Okay, stand nice for me. There we go. Okay, that's fine. Thank you so much. Yeah, so you can go and take a seat now. All right, thank you. Alright, so height, weight in kilograms, we are okay, so I'll just try to work that one out. Okay. Okay. So that's not too bad actually. That's quite good. Okay, so your BMI is matching up quite nicely. Okay, so I'm not concerned about that. How do you feel about your weight? Yeah, are you happy with it yourself? Good, good. Yeah, well, we'll worry about that in the new year after Christmas. I mean, I'm not even attempting to try and lose any weight at the moment, or exercise or tone up. No, I want to treat myself first, so you treat yourself. But you look absolutely amazing, so, you know, you're doing a really good job. Yeah, looking at you look really healthy, you know, so, but it's a personal thing sometimes, isn't it? But, you know, try not to, you know, push yourself too hard. Okay, enjoy Christmas first. Right, okay, so let me move on. Where are we? Okay, so I'm going to check your temperature. Okay. All right. Lovely. Just is normal, around 37 degrees. Okay. So great. Okay. Where are you? Is it okay with you if I just have a little look in your ears? Yeah? Okay, thank you. Okay. There we go. Perfect. So put that on there nicely. Okay. So we are nicely. Okay. Going to come a little bit closer. All right. Okay. There we go. I'm just going to pop that in now. No blockages. No reddening. Absolutely nothing at all. It's great. How do you clean your ears? Ah, whatever you're doing, it's working wonders. Oh, do you? Yeah. Poppy ear candles. I've tried them once or twice before, but I must be doing a really good job for you. Might have to give it a go myself. Right, let's check this side. Okay, I'm popping it in. There we go. That's pretty much the same this side too. Really, really nice and clean, and really looked after well. And is your hearing okay? Okay. It is. Okay, that's really good. So you've no hearing issues, or that's fine. Is there any hearing problems in your family? Okay. Alright, let me just pop the ear check down. Right, do you wear glasses or not? Okay, right, first of all, I'm going to pop a finger up and I want you to tell me what number you can see. Yeah? Okay, so the first one. Yep. Yeah. Good. Yep. Mm-hmm. Good. And are they all right to see? Nice and clear, not blurry? Perfect. Okay. Same again on the other side. Good. Yeah. Yep. Perfect. And they were okay, clear to see, not blurry. Okay. Same again, but straight ahead. And I'm going to pop different amounts of fingers up. But I need you to look straight ahead. I need you to see if you can see what's going on aside of you. Okay, so like your peripheral vision. Yeah, I will be a bit here, there, maybe a little bit close and things like that. Okay, all right. Okay, you ready? Good. You're doing well. That's it, perfect. You look at my nose. Mm-hmm. Good. Now this side. Perfect. Okay, same again, but I'm going to do both sides, okay? So I might move this side, I might move that side, but I need you to look at my nose. Okay, ready? Good. Right. Don't look so worried. You'll be alright. Okay, ready? Good. Mm-hmm. Okay. That's good. I'm watching the concentration. Yep. You see that okay there, yeah? Sure? Okay. Okay. All right. Yeah, I just thought you were a little bit hesitant, that's all around there. Don't worry. I'm just going to concentrate on here. So I'm going to do the same type of thing, but just numbers 1 and 2. Okay, so like 1 finger or 2 finger, etc. Okay, good. Okay. Good. That's it. Doing really well. Good. Excellent. Perfect. Very happy with that. Well done. Okay, if you look at me, nose, I'm going to put my hands here and I need you to tell me which side you saw move, but without looking directly at them. It's a bit like what we've done just. Okay. Good. Good. What's it? Perfect. Okay, closer in. Good, good. A bit further out again. Ready? Perfect. And now I'm going to do it a lot closer to you. So about here. Okay. Look at my nose. Okay. Good. It might have helped though that it was by your ears. Don't worry, I believe you. You'll get used to me. Yeah, no concerns there at all. Brilliant. Are you up to date with your eye check. Good. Eye check. Perfect. What about your dentist? How often do you go to the opticians? Okay, do you make sure you do go? Good. What about the dentist? Good, that's really good. Make sure you keep that up. Alright, brilliant. I'm not going to assess your teeth or anything, but I will just take a quick look in your mouth if that's alright. Thank you. Okay, you can open wide for me first. Tilt your head slightly. Thank you. Stick your tongue out for me. Nice, healthy colour. That's good. Okay, I'm just going to pop that in now. That's it. Excellent. You can say R for me. Good. Okay. Okay. Wonderful. Okay. Thank you. Put that down now. Your teeth look fine, your gums look fine. Can't see any ulcers or any thrush or any lesions or anything like that, so it all looks really good. So, very pleased with that. Okay, so that's hand sanitised. Right. I'm now just going to have a little look in your eyes. I'm not going to do too much, alright? Just want to have a little look myself. Okay, just look at me. Thank you. What beautiful colour eyes. So pretty. And big. All looks healthy in there. All the whites are nice and white. Which is good. Pupils retracting as it should. No yellowing or redness. Okay. You can look at me. Good. Perfect. Your eyes look really healthy. Which is really good. Okay, now I'm just going to do a little hearing test. What I mean by that, it's nothing fancy. I'm literally going to get you to close your eyes. Okay, I'm going to put my hands either side of your ears, and I need you to tell me which side you heard. Okay, get a little bit closer. Right, so close your eyes for me. Thank you. Okay, and now we'll begin. Doing well. Good. Okay. Perfect. Now I'm going to whisper two things on either side of your ear. Repeat it for me. Okay. Next word. Cake. Cake. Good. Now two different words this side. Cucumber. Cucumber. Okay, and second word. Relax. Relax. Excellent. Well done. And you can hear everything perfectly fine. No issues at all. Perfect. Excellent. Right, so I'm really pleased about that. Do you experience any blurred vision, double vision, any spots crawling or anything like that at all? Brilliant. Fantastic. That's really good. So, where are we? I'm going to have a listen to your chest now, and what I'm going to be listening to is your heart first, okay? All right. Okay. Could you just move your top up slightly for me? Thank you. This may feel a little bit cold, so I do apologise. If you can just breathe normally for me. Okay, thank you. Any heart issues in the family at all? Okay. Okay. Right, can you just relax for a moment? I'm now going to listen to your lungs, okay? So I want to hear you breathing. So let me get that back in my ear. If you can start by breathing normally, okay? Okay, might be a bit cold still. Okay, so normal breathing. That's a nice breaths. Okay, start to breathe a little bit heavier, so a little bit deeper. That's it, like that, thank you. Okay, now can you take a deep breath in for me and hold it and release? That's it, that was perfect. And again. Okay. And again. And one last time for me. That's it. Perfect. Okay. Okay. That's really good. Pull your top down. Okay, so just check your pulse. Index finger in that for me. Thank you. Stay nice and still for me. Okay, perfect. Thank you. That is perfect. So let's rest forward. Okay, that's good. Okay, I'm now going to do blood pressure. Okay, so I'll take this arm, just relax it on that table there for me. Okay. Pop that there, wrap that right round you. That's it, just like that. Okay, good. Okay, so that's there. Pop these in. And pop that Just relax for me, okay? Don't move or don't speak, but don't stress. It's going to start going quite tight. Right. Oh, yeah, there we go. That's fine. Okay. So the rest should come out in a moment, alright. Okay. Okay, that's fine. Before I take some blood, I just want to ask you if there is anything that you are concerned about at the moment with your health. Okay, so you're feeling alright? Good. Yeah. Okay. Well, in the mental health review we can cover that. Yeah, don't worry, I won't leave you too long. Yeah, I'll try and get you in next week if I can, if that will be any help to you. Yeah. Okay, it could be a little bit of SAD, seasonal affective disorder. Do you feel like this quite often, or? Okay, let me jot that down. So, do you mental health review and questioning SAD? Okay, so you've got so you're lethargic, you say, fatigue, miserable, depressive, want to sleep. Okay, anything else? Okay, so yes, so other typical depression type symptoms. Okay, you can actually, yes, even though you've got mental health issues and suffer with depression and things, you can still actually get SAD on top. I know most people think you can't, but you can. Yeah, and it's always things that we look at is how tired you are, you know, are you going out, so you get enough sunlight, and it's hard, when it's always dark here and gloomy at this time of year. But I won't go into too much detail about that yet, because I'm going to add a couple of tests into the blood test, which I want to do first, okay? And I want to see you, and it will have to be quite a bit of a longer appointment when I see you next time, because we're going to discuss the medication and the mental health review in general, but then I do want to discuss SAD with you. Okay, yes, definitely. And I can give you some information sheets and things, and when I've looked at your blood, it can get me a little bit more of an insight too. Yeah, if you don't mind. I would like to do it properly, you see, I don't want to rush it. Okay, thank you. Don't worry, I'll have a look for you in a moment. It does sound like it, but I do want to be sure. Okay. But other than that, everything's okay. Perfect. That's great. Right. do we have a best arm? It's totally up to you. I mean, if you want to do some pumping action for me first. Yeah, just with the both. Do that for me whilst I get it sorted. Right. Those. Are you alright with normal plasters, or would you like to use a bit of cotton ball with some tape? I know some people can be a bit allergic to that. It can leave a little bit of a red irritation. Yeah, I don't mind, whichever is best for you. Okay, that's fine. No, not everybody asks, but you'll just stick anything on that to you. Okay, then I'll pop my down here for you. Yeah, I can do that. So, not a problem. Okay, just relax a moment and check. Maybe one there. About that side. I'm going to go for that side. You've had the blood pressure on there, so it may have helped it a little bit. Okay. So on to that. One of these. Little one. To be honest, I prefer a plaster. Well, I prefer nothing actually. I prefer just to let me hold the cotton pad on and that's it. But if I had to, then I would choose a plaster. Okay. Let me just get this. So we'll do 2 tubes today. Okay, so tubes. Okay, so bloods. Okay, so full blood count with function, vitamin D, and iron, hormones, sound, Is there anything in particular that you would like me to test for out your blood? I've done the ones that I would definitely need to do and would want to do. Is there anything you feel that you would like me to test? Okay. No, okay, yes, alright, I will add that one on. That makes sense. Okay, thank you. Okay, so if you want to do that, then I'm going to add the other one too. Yes, okay, that's fine. Okay, so that. Okay. 2 should be enough for that. Okay. Okay. Once I've done this, I'm happy for you to go and enjoy the rest of your day. Okay. 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 Just your arm for me. Thank you. Okay, let me just check. Yeah, that's good. Right then. Okay, just leave your fist like that for me. Okay. Let's control your breathing. Think about your breathing. Can you feel a sharp scratch? No. That's good. So you're doing really well. Okay, and just the next bottle. No, take that out and press. You're right. Good. Is that right for you? Yeah, it's alright then. As long as I didn't hurt you. Yeah, they can be a bit sharp, but you know, I know some people say it's not very comfortable, and others they can't feel it, and others they say it hurts and all sorts of things, but it shouldn't do at all. The more water and fluid that you drink and the more relaxed you are really does help, but it also helps if you have a good doctor doing it, or a nurse. Okay, that's stopped now. Find the bin. I'm just going to pop this on it just in case. Okay, there we go. Pop it down nicely. There you go. I'm done. Right. Right, so take perfect. That's brilliant. So so Perfect. I will get those sent off today. Okay. Yeah, they'll be all sent off and should be back in a couple of days. Okay, right, I'm happy now with the check. All right, I'm going to just book you in now, the appointment for medication review, mental health review, and to talk about SAD and have a discussion, see if you do have that. Okay, so let me look for next week. Okay. How is Wednesday? Same time? Great. I'll pop that in. Look through the days of the week. 2, 3. How is Wednesday at the same time? Great. That's all booked in for you. Okay, right. So the bloods I should get back within 24 hours or so. Okay. I will probably wait to see you to discuss them with you. Okay. Yeah, it's only a few days, so you know, give us time to get them through and sorted and things like that. Okay. And then we can go through our review on medication, and we can also go through a review on your mental health, and then obviously discuss everything with concerns around SAD, and obviously discuss your blood results and take things from there if that's okay with you. Great, not a problem. And I will say, make sure that you sign up online for the patient access service. Okay, that'll be really useful for you to do. Okay, you can book an appointments on there, request your medication, you can, you know, find out all sorts of information, things like that. It's really, really useful. Okay, all right, and then you'll find a lot out about here as well and things like that, so be very useful to have. Okay, do you have enough medication, or do you need me to print you some? Oh, what I'll do, I'll just print you one off now with what we've got on the system, just so I've got enough. I don't want you to run out. Okay, I know it's only a few days, but you know, I don't want you to get yourself all stressed out. Okay, I'll do that one for you then. Okay, so let me see if it's going to let me print it. It didn't work earlier, so I may have to write it. Let me just check. I think it's going to be playing up again. Typically. Okay. I'll just make sure I have everything. Okay. Right, just remind me of your address, please. Okay, and postcode. Excellent, got your name, date of birth 35, that's not a problem. Okay, so we want 14 days worth of those, then continue of this. Fine. Excellent. There we go. That is your prescription. Okay. If you could get that as soon as you can, that would be really great, just to make sure you don't run out. Okay. And then I will see you on Wednesday at the same time. Okay. It's an absolute pleasure to meet you. It really has. It's been lovely. Yeah, but don't worry. I know you're looking a little bit stressed out about your mental health and things, but you know, we'll get this sorted. Physically, I can't see any issues, and you said you are feeling fine, and the issues that you do have are all under control, so everything is perfectly fine, so don't worry. I know when mental health triggers off, it causes all sorts of worries and concerns. Yeah, I get that. I really do. So I can understand why. Yeah. Alright. Okay. Well, you have a lovely weekend. Alright. And have a nice week. Yeah. Alright then. Yeah, don't worry about it. No, honestly, don't worry. Don't worry about it at all. No. Don't think of it like that. Don't. Okay. Alright then. Well, you take your time and, you know, come back and see me, and then we can go from there. Alright. You take care now. Bye bye.